People affected by cancer need to be at the heart of this partnership, and they need to be listened to. And ironically, it's through interacting with people affected by cancer that the partnership organisations learn that they need to be flexible, that people won't always be able to make meetings because they have treatment or what have you. It's organic and it needs to be flexible, and that's what they need to transfer into the services that they start delivering. Flexibility, coordination, serving the needs of the patient.
Not only have you actually fought a very, very difficult battle, you don't want to fight another battle by getting depressed and having anxiety and fear kicking in. And these are the things that I think need to be identified from the start, even prior to even treatment. Knowing what is going to happen, knowing what to expect, and knowing that this sort of support will be put in place for them. And also about being an open access. I think, as just because it may have been a couple of years, 4 years, 5 years along the line, as a patient, you should be able to feel that I'm not sure about something, I want to pick up the phone and speak to someone.
The breast care team actually contacted me to see how I dealt with my chemotherapy treatment, how I was coping with the side effects. They explained to me why there were side effects, how long those side effects would last, and what to do if I felt unwell throughout the recovery period. Given that I went straight on to radiotherapy, they then explained to me, or the breast care team then explained to me what would happen within the radiotherapy. So I just felt that they were with me every step of the way. The importance of having a care plan on an individual basis gives you time to review all the information, because sometimes when you are talking on a one-to-one with a consultant or your chemotherapy nurse or something, there is so much information that you need to take on board, and I always think it's good to sit down in your own time and review the information. You can then go back to them. One of the things with the breast care team is that no matter what time, night or day, you can actually contact them. When I first started my chemotherapy, I had some very severe spasms and I had to ring them very late at night. And they actually contacted the hospital to say I was on my way, and I couldn't believe that. I thought that was amazing.
And patients were telling us that in actual fact they were repeating their story constantly, and they would often say when you arrived and you'd say, tell me a little bit about how you got to this place. Don't you know? Hasn't someone told you?
The district nurses at Victoria Mill work alongside the Macmillan nurses, so they all talk to each other. Now this was a revelation, that I'm not used to medical people talking to each other.
We have this meeting at 12 o'clock daily. It allows us to come in and speak face to face, bounce ideas around as a team, because we're all professionals, we all got our own knowledge, and we can problem solve in one room. It allows that, and that wasn't there before.
The daily handover has made us really effective. It's opened lines of communications that, even though they were there beforehand, it was that we were chasing people to try and communicate with them. So the fact that we have the district nurses at the meeting, the dietitians, the physiotherapist, the speech therapist, the CNSs, our assistant practitioners, we have the full range of people that are supporting our palliative care patients. So we've now got 4 hubs, and there's assistant practitioners working across each of those hubs. Has allowed us to actually increase the amount of times we see patients, and actually when they go, they can do multiple things in one session. So they might be able to do speech therapy exercises, but also review their pain medication, also do a dietetic review. So actually the patients get a better service, they get the specialist input, but then they also get the continuity of care through the assistant practitioners.
I think the most significant point in realising where the team was and where it was coming from was when my GP arranged, I think, what they call a multidisciplinary team meeting and invited my family to join in as well. It was a very sort of intense meeting. Everybody was listening and they were all putting in their contribution at the right time and at the right pitch. And it was only afterwards that I realised that everybody there was caring for me.
I think if you know that the surgery signed up to the locally commissioned service, although you might not understand, you won't think of it in those terms, but if a patient knows that the surgery is positive about cancer, has a positive attitude and is there for you, you're going to feel a lot more confident in approaching them and feeling that you're getting good advice. Because if you're going to the surgery, for example, saying to have, you need some blood taken, and people don't know, for example, that you can't have your blood taken from your arm with lymphedema in it, you start not to trust the surgery because you're thinking, surely they should know that. So you want people that understand all aspects of the cancer, which I know is a massive, massive ask, but that's why there's so much training and education, because it really will benefit patients if they feel confident in what's happening at the surgery.
I've been diagnosed with cancer at the very, very early stages, so I'm really grateful that I went for this lung check. I went to the scanner on the precincts on the Tuesday. It was about 9:30 in the morning, and I wasn't there long. I was there about 20 minutes. I was notified by Wythenshawe Hospital with an appointment for the Tuesday. So within a week, I went for a lung health check, and I was then given an appointment at Wythenshawe Hospital within the week. So I think the timescale was absolutely terrific. I hope there's more of these scans about for other people to get the benefit that I've got. And they're definitely nothing to be scared about. You lay on your back with your hands behind your head, and you don't go in and out. All it is a donut that circulates just round and round. You don't actually bodily, physically move in any way. You just lay there. A lot of people have got the wrong idea, thinking that you're going to go in a machine. And some people think they'll never come out, but it's nothing like that. I'm not living in fear thinking, have I got cancer? Because now I know I've got it. And hopefully, because of that lung health check, I'm going to be living for years.
Well, I think one of the things that the patients were telling us was that when changes happened in their cancer and its treatment, they felt that they were having to explain that to all the different people they were seeing.
I think the most difficult bit is because I'm under a number of different hospitals with a number of different consultants. Not all cancer, but it all has to be organised together, and I have to fill in each different consultant with my story and my journey and where I'm up to and what my drugs I'm taking, because I have a thyroid problem. So that is actually dealt with Christie's, but a different consultant, needless to say, to the oncology team. I go to Salford Royal for my spine, that is the cancer, but again it's a different hospital. I go to Wythenshawe because I have a urine infection, so that has to be kept to check on. And then there's the breast surgeon at Wythenshawe, and my rheumatologist at Altrincham General.
It's a lot of different people are involved in the pathway. It's not just one place anymore. And the needs of the patient mean that we need to move with times and look at what we can do. So as healthcare professionals, we need to be in touch with each other and be able to pass information backwards and forwards easier so that the patients don't feel they have to do that for themselves.
Well, MSEP have really helped us to focus on the pathway and redefine it, and to look at the key points that those patients need input, and that's helped us to develop our service as well. We now see all new secondary breast cancer patients within a month of diagnosis, and they have a full nurse-led appointment with a holistic needs assessment. That information is then shared with the GP So there's good coordination of care from the beginning, and that patients know where to get their support from.
It's giving patients control back when they're in a situation where they feel like they've not been in control.
What's particularly pleasing is that many of the things that myself and my colleagues, not just me, have said have been taken on board. And so with regard to the presentations, with regard to the written documentation and so on and so forth, it has very actively involved the user's contribution as well.
I think that in terms of my experience volunteering with MSIP, I was diagnosed with breast cancer 5 years ago, and had a fantastic experience in terms of treatment from Manchester hospitals. But I wanted to bring that to improvements for people who are affected by breast cancer, because I knew that there was lots of things that I had to source for myself, and I could do that because I'm a confident person and I know where and how to get information. But what I realised was that not everyone does. So when I'd attend focus groups and I'd get reports, and I could actually give feedback at focus groups in terms of the things that were important for me.
We're only as good as the support we get. We can't do it all on our own. We don't know. If you're not told what's going on outside of the room, you just go into a meeting and react to that. You need to know the full picture, and you need to have all the papers. You don't know what's going on around the meetings. If you've got the right support, you do, you find out. The fact that you actually get to see people face to face at a lot of these events, if you're dealing with GPs, you can be sat at a table full of GPs, and when the patient starts speaking, they tend to listen. They'll shut up and listen to us. That's the difference.
One thing that I've found about the MSIP project is it's been hugely encouraging as a patient to see just what goes on behind the scenes. The doctors, the nurses and breast nurses and everybody who has been involved in this pathway of care are so dedicated and are so involved in making your care better. And I think it's absolutely incredible, because as a patient sitting in the waiting room with people whinging about time and waiting, they have no idea what goes on behind the scenes, and it's absolutely incredible how dedicated everybody is. And thank you.